physician. Doctor, thanks for being here.
Thanks for having me.
So some people may not be aware of hantavirus, but we heard from officials there that though it is rare, they do have several cases in New Mexico a year. This is a mandatory reported illness that if, for example, the New Mexico Department of Health sees one of these cases, they alert the CDC, which happened here. What are your big top lines for us to know about this?
Yeah, so it is very regional. It's kind of located in the Southwest United States. It's usually something that's spread by rodents. And so usually folks that go out camping are very aware of this because they don't want to get bitten by rodents. And usually it's a bite or, feces or saliva of a rodent that infects you. There's various stages of this. And so initially it presents kind of like a viral syndrome. So, body aches, fatigue, fevers, that kind of thing. And then when it becomes very dangerous is when it kind of turns into this pulmonary syndrome where you have difficulty breathing, you get fluid on your lungs, and that's unfortunately when people pass away from this virus. So it's very regional, but obviously something very dangerous.
How would somebody come into contact with rodent excrement, or how would somebody contract this? How does it pass from rodent to person?
Yeah, so some type of contact. Usually, the most kind of common cases that we hear about is you were either hiking and you went into a bush and kind of came into contact and maybe got bitten, or you're at a camping site and your food or some other substance got contaminated and you got into those substances. So it has to be some type of direct contact. Of course, rodents can get into homes, and there have been reports of that as well. And so it requires some type of direct contact. And then unfortunately, that's where it kind of takes off from there with a human getting infected.
The mortality rate to me, doctor, and I'm not a professional, so please correct me if I'm wrong. It's the mortality rate seems high to me. Is there a treatment? Is there a cure for hantavirus?
Yeah, so it is unfortunately no cure. It is a high mortality rate once it does progress, especially to that pulmonary syndrome where your lungs kind of fill up with fluid and
Mm.
whatnot. The only treatment we have is supportive care, and so that basically means if someone is having respiratory distress, putting them on, oxygen, maybe putting them on mechanical ventilation. If they're having, you can have kidney failure with this, giving them fluids, maybe putting them on dialysis, those kinds of things. But there's no medication or no potion for this antidote for this, unfortunately.
So, given what we heard about Gene Hackman's health, I'm just going to rattle off a little bit of what investigators said. 95 years old, evidence of heart disease, advanced Alzheimer's disease, no internal, external trauma, evidence of previous heart attacks, changes in kidneys due to high blood pressure, negative for hantavirus, and carbon monoxide. What are your takeaways from what we know about Hackman's health and the fact that he passed away about a week after his wife?
Yeah, so from kind of this report that we heard, he did have some memory issues as well, and so obviously, anytime you have cardiac issues and whatnot, you have to be on a very strict regimen of medications, and missing even a few doses of those medications or not having those on time can unfortunately be deadly. And in his case, unfortunately, maybe he got to a point where he needed immediate medical care and he wasn't able to seek that immediate medical care because his wife had passed away. And so obviously we're speculating right now, but anytime you have many medical conditions, you have advanced age, and you have some degree of memory issues, that's why we need caretakers. That's why we need family to be checking in on patients. And unfortunately, when that caretaker is taken away from that picture, bad outcomes happen.
Well, Dr. Oysterani, we appreciate your expertise. Thank you for your time.
Absolutely.